Hello everyone, good afternoon to you all. My name is Daniel Chance, lecturer of pharmacology and clinical pharmacy at Kampala International University, Western Campus. And I am the patron of the Antimicrobial Resistance Club of KIU, which was recently launched in February 2022. Today I'm here to talk about antimicrobial resistance and why it's important for us to create awareness about antimicrobial resistance. Antimicrobial resistance simply means loss of effectiveness of an antimicrobial, that is a drug that was initially effective in treating an infection. And this means that the infections are going to become harder to treat, they are going to become more severe, that means they are likely to cause death, and they will be more costly. The infections are caused by microorganisms, which include bacteria, viruses, fungi, and protozoa. So the bacteria can cause infections which include sexually transmitted infections such as syphilis and gonorrhea, or upper respiratory tract infections or urinary tract infections. Fungi can cause common infections such as candidiasis. This can be vaginal candidiasis or oral candidiasis. They can also cause ringworms. Protozoa can cause malaria, which is common in our setting around here. And viruses include the HIV virus, which causes AIDS. The drugs used for treating these infections include antibacterials such as amoxicillin, ampicillin cloxacillin, commonly called Ampiclox, azithromycin, ciprofloxacin, and gentamicin, amongst others. The drugs for treating fungal infections include clotrimazole, which usually comes in a cream, fluconazole, ketoconazole, and griseofulvir, among others. The drugs we use for treatment of malaria include what people commonly call Coartem. This contains artemethyl-lumefantrine and quinine, amongst others. While the drugs we use for treating viral infections include the antiretroviral drugs, which people commonly call ARVs, that include drugs such as efavirenz, drugs such as dolutegravir, drugs such as lamivudine, and most of these usually come in. The combinations include Atripla, Combiva, Truvada, Combiva N, among others. Antimicrobial resistance mainly develops as a result of exposure of the microorganism to the antimicrobial agent, coupled to other factors such as overuse of the antimicrobial, misuse of the antimicrobial, overprescription of the antimicrobial, and several other factors which we shall explain in the subsequent recordings. The overuse and misuse of these antimicrobials can be through self-medication or through overprescription of these antimicrobials, but it can also be through consumption of animals or animal products, because some of the antimicrobials we use as humans are the same antimicrobials that are given to animals, but it can also be through the environment. Antimicrobial resistance is a concern because according to World Health Organization and CDC, about 700,000 people die annually due to AMR, and this number is expected to rise up to 10 million people by the year 2050, costing more than 100 trillion US dollars. In the same regard, a study published in The Lancet, January 2022, which was a systematic review, revealed that in the year 2019, 1 in every 5 deaths due to AMR was a child under 5, and 1.2 million deaths were due to antibacterial resistance. A study by Lugwama and colleagues in 2021, which was conducted in 3 East African universities in Kenya, Uganda, and Tanzania, revealed that the highest percentage of final year medical students and pharmacy students had low knowledge about antimicrobial resistance and clinical use of antimicrobials. It is against this background that the Antimicrobial Resistance Club of KIU was created, to improve awareness and knowledge about antimicrobial resistance and antibiotic use among medical students, pharmacy students, nursing students, and other healthcare students in different universities. Always remember to give the right drug at the right dose to the right patient for the right time frame and for the right indication. Fever is not a sign of antibiotic deficiency. Promote rational use of antimicrobials to stop the spread of antimicrobial resistance.